Yes, sure. You may start.
Yes, sir. Just give me a minute. Yes, sir. So we are starting the meeting, sir. So
Yes.
welcome to Vizag Bay Section COMSOC SPS Joint Chapter Webinar Series, sir. It's
Thank you, sir.
really
Thank you.
so on behalf of Vizag Bay Section and COMSOC SPS Joint Chapter entire team, we invite you to this webinar series on advancements in image processing, and we are planning two more lectures in this series, which are to be organized in this month only. And
Okay.
coming to my Communication Society and Signal Processing Society's joint chapter, we have a very good team with myself as a chair and Dr. Pulikishore Kumar, who is from NIT AP. He is the vice chair,
Very good.
and we are,
Very good.
yeah, yes, sir. He has also joined, and we
Okay.
also have along with him Dr. Hema from JNTU GV Vijayanagaram, and
Okay.
Dr. Ganesh from GV Gayatri Vidya Parishad College for Women, and
Okay.
Dr. Sridhar from my own institute, Raghu Engineering College, and Dr. Subbarao from Bhimavaram, Sri Vishnu Engineering College for Women. So, and we also
Yeah.
have a past chair, Dr. TSN Murthy garu, who is from JNTU GV. Under his regime, the chapter has actively organized several activities, and to mention, there are two seasonal schools which we have organized, and one has been, I mean, one is with international collaborations with different chapters around the world. So we are very happy that the same we are continuing. But yes, we
Mhm.
are still working towards some better events. And coming to my Vizag based section, so earlier it was a subsection under Hyderabad section, sir. And 3 years ago, we have this subsection has been elevated to a section level with 5 to 6 districts geographically
Yeah, yeah.
from
I
in Andhra
just checked
Pradesh.
it. Yeah. Yeah.
Yes, sir. So,
Mm.
the Dr. SLN, we call him as SLN, while,
Okay.
actually his name is Dr. Lakshmi Narayana Sadasivani. He is
Okay.
instrumental in elevating this subsection to section. And fortunately, he is also, being a part of the slate in for India Council um, president. Yeah,
Okay. Okay.
he's a candidate, and along with him, I think I also have to mention that Dr. Bajaj, who is from Mumbai section, I believe. So together, they are part of this slate for India Council elections, and we are also looking forward for people who can who vote extensively for our SLNSR and elevate him. We want to see him in the India Council chair. So
Yeah.
so that's the reason why he could not join,
Okay.
because he's a part of the slate. He cannot be in any IEEE activity which is publicly addressing people.
Good.
Apologies, sir. Otherwise, he would have given a better picture of Vizag Bay section.
No, no, not at
So I
all.
have to
Even
take. Yeah, yeah.
you have given good enough, and I even read it last day only, so it's
Hmm.
perfectly clear.
Yeah, yeah, yes,
Yeah.
sir. And yes, sir, we have different communication society and signal processing societies, student chapters in different student branches in all the 5 to 6 districts under this
Okay.
section, sir. and all of them are very vibrant, and we have very good number of students, and there are about 72, 77 professional members who are coming under COMSOC and SPS. So that's in fact a very good number. uh, now, without delaying, I just also would like to acknowledge the support extended by our IEEE Vizag based section chair, Dr. Abraham Varghese, who is also happens to be who is also the director of Naval Scientific and Technological Laboratories in Vishakhapatnam. So that's a very big role, and he has given consent, and he is leading the IEEE Vizag based section immediately after Dr. SLN. So such a big role, he is managing both the things. We are very happy because though he is a very busy person, he still managed to support us in every activity. And along with him, we also have a big slate covering several people from different academic and industrial backgrounds, spread along the entire sections geographical region. So this is it for about my Vizag based section, COMSOC and SPS joint chapter of Vizag based section, and this lecture series. Then I request our student branch, student chapters member, Miss Rajeswari, to introduce Dr. Vikrant Bhateja to the and all the audience. Rajeswari, over to you.
Yes, sir. Good evening, everyone. Thank you all for joining us today. It's my great pleasure to introduce Vikrant Pateja. Sir, Vikrant Pateja is Associate Professor in Department of Electronics Engineering, Faculty of Engineering and Technology, UNSIET, Veer Bahadur Singh Purvanchal University, Jaunpur, Uttar Pradesh, India. He is also serving as Head Computer Science Engineering and Information Technology in the same university. He holds a doctorate in ECE, biomedical imaging, with a total academic teaching experience of 21 years, with around 190 publications in reputed international conferences, journals, and online book chapters contributions, out of which 40 papers are published in SCIE indexed high impact factor journals. One of his papers, published in Review of Scientific Instruments (RSI) journal under American International Publishers, has been selected as editor choice paper of the issue in 2016. Among the international conference publications, 5 papers have received Best Paper Award. He has been instrumental in co-chairing around 30 international conferences in India and abroad as publication TPC chair, and edited 55 book volumes from Springer Nature as a corresponding co-editor author on date. He has delivered nearly 25 keynotes, invited talks in international conferences, Atal TEQIP and other AICTE sponsored FDPS and STTPS. He has been editor-in-chief of IGI Global International Journal of Natural Computing and Research, IJNCR Journal from 2017 to 22. He is guest editor in journals like Elsevier Measurement Springer, Evolutionary Intelligence. He is senior member of IEEE and life member of CSI. Published research has a current high index of 35 on Google Scholar. Thank you, sir.
Thanks, Rajeshwari, for such a lengthy introduction. I thought you would cut short it so that we can proceed with the lecture.
Yes, sir.
Samir sir, shall I share the PPT and start?
Yes, sir, you can start, sir.
Okay.
I am muted, so. Sir, can you share, sir?
Yeah,
Is the
I'm
share button? Okay. So Rajeshwari wants to share a lot of screen space. That's why she has taken the entire text.
okay.
No, sir, nothing like that.
Yeah, that's fine.
Just a sec. Actually, I think there is some.
You are co-host, sir. No problem.
Okay. It is giving optimize for text and images. Is it some option in this, or optimize for motion and video?
No, sir. You can see that entire screen on the left hand side. That you can do. You can select that one.
Okay, okay. Yes, yes, yes. Now I got it.
That's better.
Yeah. Yeah. Is my screen visible?
Yes, sir. Perfectly.
Just a moment. So, good evening to everyone, and this is our today's lecture session on computer-aided diagnosis of life-threatening diseases. Now, since this is a very wide area, rather you can say that earlier image processing or signal processing has been on the subject front, but nowadays if you are going to pursue advanced courses in say IIT's institute or say triple IITs with image processing as specialization, then generally medical imaging or computer aided diagnosis is sometimes being offered as a specialized elective paper. So now it has been pursued as a very vast
Sanjay sir,
domain
good
of
evening.
research.
Samir sir, good evening. Kishore sir, Rajesh
Yeah.
sir.
Yes, sir. Meeting started, sir. Chisti
Yeah.
sir.
So this is a very wide area of research from that aspect. A lot of things come into it from biological point of view, from engineering point of view, from signal processing point of view, and from AI point of view. So that is why the focus for today's session, I have mentioned it very explicitly that our focus will be on medical image processing and analysis point of view, and along with some traces of that how AI is being integrated in this respect, we will be talking about it. So talking about the extent and spread of this domain, this is well covered under the scope of IEEE Signal Society and IEEE ComSoc also. So Rajeshwari has already given my brief bio, and this is the research areas pertaining to biomedical imaging where I have already worked. So talking about today's session, I will be talking about these 5 modules in this. First one will be an overview of life-threatening diseases and medical imaging modalities. Then second one is introduction to CAD. Then we'll be talking about intelligent CAD systems, CAD datasets, and CAD-based research perspective. So let's start the first module, that is the introductory part, life-threatening diseases and medical imaging. So since our focus as an engineering point of view is always to focus from signal processing or image processing point of view when we are talking about biomedical imaging or computer aided diagnosis. But before we delve into our technical specific terms, there is a very vague sketch of some biological aspects which are some basic preliminaries, and they should be very crystal clear before we move forward in this. So when we talk about life-threatening diseases, So the life-threatening disease, there could be many, but as a subset of what we will be talking in the context of today's lecture is basically cancer. So if we understand cancer, it is an uncontrolled, uncoordinated, abnormal growth of cells. So we are calling it uncontrolled, we are calling it uncoordinated. Why? Because when this type of growth occurs, we cannot at a time predict the stage so easily, because maybe today the particular cancer thing could be in stage 1. After 15 days it can land into stage 3, so that is why it could be an uncoordinated growth. And if not grown, if it is stagnant, then it can lay untouched benign for another 15 years. So that is why it is very, very uncontrolled. It is very, very unpredictable. So generally, a tumor is an abnormal mass of tissue, which is actually an outcome of this uncontrolled growth of cells. So this cancer could be of any form. It could be a form of malignant tumor. So how we understand this in graphical manner, let us see. Say suppose if we see this is a sample of a cancer cell. Now, if you see, the periphery of this particular cells are very rounded, they are very regular. So generally, when they are rounded, they are very regular periphery is there, then generally they are not harmful. But slowly, if you see, with the expense of time, you can see there are some periphery boundaries are being disturbed. These speculations are originating from the boundary of this particular cell. And once these edges, these borders are getting disturbed, that means these speculations are originating, what we say that now the cell is landing into malignancy. Then once these speculations originate, what happens next is these start entering and start penetrating to the other nearby cells, and this process then keeps spreading to another cells, nearby cells, and finally you can see that a lump, a mass or a tumor is being developed in the body. So this is basically the biological cycle, how this tumor growth basically occurs. So if we want effective treatment of cancer, generally it appears into these imaging screening types, whichever image screening we are using, whenever it comes to a glance, whenever comes to a notice, then what happens is generally the stage comes out to be a very advanced stage. That means the symptoms are visible only when the stage has pursued to a very, very later stage where treatment could be very difficult. So generally what is advisable is that if somehow screening is done early, or if we are able to catch or detect this particular tumor, its growth at a very, very early stage where these symptoms are not visible. So when we say the symptoms are not visible, we are calling that particular stage as the asymptomatic stages. So once we are detecting it at this particular cancer or tumor at an asymptomatic stage, then this is actually the detection of this cancer at early stages. So for this basically early stage kind of a detection, what comes into being is computer aided diagnosis of these cancer or computer aided diagnosis of this life threatening diseases. So now the basic source, I mean the basic screening for these particular type of different parts of body is being done by different medical imaging screening modalities. And if we take a quick overview, we have different modalities which are existing over here. They are MRI, PET, then we have X-ray, then we have CT scan, then we have ultrasound. MRI, you must be knowing that this is the outcome of the magnetic fields and radio waves that you get a final image which a very good resolution, right? Similarly, PET scans uses radioactive drugs for they are generally called tracers for the part of scanning a particular part of the body. A very common one is the X-ray. Very popular one is the X-ray, and they are very quick. It is very non-invasive kind of a technique where you can produce images of the structures of the body. Then CT scan, that is computed tomography scan. This is the advanced version of these X-rays. And then you have ultrasound, where generally we are screening the abdominal tissues, abdominal parts of the body, or you can say the reproductive organs. Then generally the focus is ultrasound, where high frequency sound waves are being used. Now, what happens is that since we have these different type of imaging modalities, so each one of these has a different source of its generation. Each one of it is having a different physics, a different acquisition methodology behind this. Now, as an outcome of whatever you can say is this acquisition methodology, what happens, the image comes out to be a good reproduction, but definitely there are a lot of challenges. Now, challenges may not be very intentional, but they are because, I mean, some device is the outcome of a particular machinery. So definitely there are some ailments, some noises, some lack of resolutions, which actually come or that they get introduced in the image. So it's a very similar concept. You can say that when you are processing a signal, then as a part of signal processing, internal noise gets embedded into your signal. So in the same way, these different ailments, they affect your signal, or you can say they affect your image, and as an outcome, you get a medical image, but it may not be of very perfect quality, or rather you can say even if the quality is good, then there are certain parts which are either not visible in a very proper manner due to the lack of resolution, or maybe because of the surrounding tissues, or there are a lot of other biomedical reasons. So this is a sample example of these images. You can say there is a X-ray, a CT scan, then MRI, ultrasound. For all different kind of disease diagnosis, these particular imaging modalities are used for screening. So this was the fundamental. Now, if you come to the next part of this lecture, we will be introducing CAD, that is computer aided diagnosis systems for medical imaging. So if we take a general overview of this CAD diagnosis system, this is a very fundamental block diagram, a very fundamental block diagram. If we see, we have a clinical data. Now this clinical data may actually consist of a repository of medical images. Now, this could be irrespective of any modality, depending upon what kind of disease we are planning to design a diagnosis system for. Now, once you have these medical images, then at the next, what we are doing, we are actually processing these medical images with medical image processing. Now the outcome of this is going to a machine learning or a kind of a AI system. Now once this is going to a machine learning or AI system, what we get over here is medical imaging analytics. That means we get some kind of analytics, some kind of predictions along with that particular image, and this forms a complete diagnostic model. So this is the fundamental CAD system. So if I try and little bit elaborate upon this system, you can see we have medical images, then these medical images are subjected to pre-processing. Why pre-processing? Because we, as I told you, that during acquisition, there are a lot of constraints which may lead to noise in those images, which may lead to resolution problems in those images. This may lead to poor contrast in these images. So for all these purposes, we are doing pre-processing. Then after pre-processing, we have a step that is known as extracting features from those images. Now, those extracted features could be many. So sometimes we select from these particular extracted features, and then it goes to a classifier to finally segregate that which all are, say, normal images or which all are the disease affected images. So if we again see that these set of blocks, they forms a module under medical image processing, and the last part when it comes to the classifier, it is actually where we start the medical image analysis. Now coming to a more detailed insight of computer aided diagnosis system. So as I told you that the very first block into this is a medical imaging acquisition system. Then we are doing pre-filtering. Why we are doing pre-filtering? Because there could be some kind of noise in this particular medical image. Now, depending upon the kind of acquisition system, the kind of acquisition constraint, the nature and the model of noise in these particular images are very, very different. So maybe if you are talking about, say, MRI images, then in MRI images, you have, say, additive noises. If you're talking about, say, ultrasound images, then ultrasound images basically suffer from a noise which is known as speckle noise, which tends to follow a multiplicative kind of a model pattern. Then if you talk about the X-ray images, then X-ray images have another kind of noise which is known as quantum noise. So the kind of noise, the kind of system, so is the type of pre-filtering or the filter that we have to use over here. So this is what basically forms the pre-processing module. Now once the image is pre-processed, that means the initial noise is being removed, initial filtering is being done. Then comes a very, very important step that is known as enhancement. Now when we talk about enhancement, actually we are talking about two unique things over here. One is contrast enhancement and another is edge enhancement. Now, these two things are of very, very much relevance when we are talking about medical images. Why? Because when it is a medical imaging system, then generally what happens, suppose this is, say, some part, say this is the tumorous region, but what happens, the surrounding tissues are sometimes are nearly similar in the contrast. So if I see that this is the foreground region, and if I say that this is the background region over here, so the contrast difference between the foreground and the background is very, very marginal over here. So therefore, we require a very good contrast enhancement technique over here. Now, sometimes the contrast enhancement technique may improve the foreground. Sometimes there is a requirement to suppress the background also, just so that the tumor which is at the surface may look a little bit more brighter. Because the challenge over here is this, that if that tumor is not possibly, if it is not properly visible, then no further analytics could be performed further on that image. So when we are talking about medical imaging, then enhancement serves out to be a very, very important step when we are doing pre-processing. And specifically, if our focus is in some way or the other in the form of early detection of tumors or early diagnosis, then it has much more relevance. Now, another thing is edge enhancement. Now, at times, because of these contrast problems, the edges of this particular tumor regions are not properly visible. And as I told you in just the previous slide, that for a particular tumor is harmful, or it is, I mean, non-malignant, or it is malignant, is can be clearly determined if the edges are clearly visible. So we are very much concerned over here with edge enhancement, because edge enhancement tends to sharpen the boundaries. So if the tumor boundaries are sharpened, then definitely the nature of the malignancy can be very well estimated. Then next comes segmentation. Though definitely you have lot of unwanted areas in a particular medical image. So it is always advisable to focus our efforts on a very focal or specific regions, what we call it region of interest. So if we want to segregate that region of interest, we are doing segmentation. So if we focus, then basically this particular module is known as the detection module under computer aided diagnosis. Then once say the region of interest is segregated, then this region of interest is used to extract the features. So what is to be well understood over here is that when we are talking about detection module, then in the detection module, what is happening is that over here an image is going and say a region of interest, or again an image is coming as an output. But when we start doing feature extraction, that means now we are taking image as the input, but now feature vectors, or you can say mathematical descriptors, are coming as output of these modules. Because now if we are going to do diagnosis, if we are going to do analytics, we have to do machine learning. And for machine learning, we cannot give the images directly. We have to convert them into feature vectors. So features are extracted, features are selected, they are optimized, and finally it goes to a classifier, which basically segregates these images into, say, malignant ones or the benign ones. So this comes out to be the next component of this CAD system, that is known as computer aided diagnosis module. So over here, with this we can summarize that CAD basically consists of two types of modules. One is CAD E and one is CAD X. So when we say CAD E, then CAD E is actually referring to this detection module. And when we talk about CAD X, it is actually referring to this diagnosis module. So both of them has a relevance. They reduce the burden and improves the efficiency. And also it is somehow improving the quality of the diagnosis. Now, if we see this system, let us see what comes at the outcome of these particular systems. So if we see over here, this is a mammogram. Now, when we say mammogram, it is actually a breast X-ray image. You can see the breast region X-ray image, and this is the tumor region, or you call it a malignant mass. Now, if you see, then as an outcome of a good enhancement technique, this is the as an outcome of a good enhancement technique, this is basically the enhanced region which is visible over here. Now, just a moment. So once we extract this enhanced region, this is actually our segmented region of interest. So you can see over here that the region is enhanced. The region of interest is segmented over here, and now the boundaries are clearly visible, and these deformated boundary is also visible over here. So this actually gives a implication that this particular tumor region is malignant in nature. So this is generally the outcome of a computer aided detection or CADE system. Now, say what could be the system or outcome of a CADX system, that is the diagnosis system. So at the outcome, the diagnosis system, the output may somewhere looks like this, where you can see that lot of suspicious regions are being highlighted by the system. Now, generally a second reader is required who have to just decide that which one is basically a very genuine marking or genuine region, or which one is just a false marking over here. This is another example. You can see that the tumor region is highlighted over here, and certain set of analytics is also being shown over here. So such kind of analytics come out of the computer aided diagnosis systems. I just give a small demo of this particular in the form of a case study of this computer aided diagnosis of breast cancer. Say this is our input mammogram. Again, you can see that the tumor region is visible in this. Then if we are doing pre-processing, then this is the image is pre-processed over here. So the noise is filtered, enhancement is done. Now one enhancement is done, the tumor region is quite very much segregated. Then we have done segmentation. That means this region of interest has been extracted. So this is the detected ROI, and this is the outcome of a computer aided detection system for breast cancer. Now coming to the phase 2 of it. Now this is the detected ROI. Then from this detected ROI, what we can do is we can extract different types of features. These could be textural features, mean, standard deviation. These are different types of features that we can extract from this particular ROI. Then maybe all of them are not very important. So maybe we are just selecting certain features. So this is what happens in feature selection. And once we have these selected features, we form them in the form of, say, a feature vector, and this feature vector is then given as input to a classifier to segregate that whether a particular tumor is benign, I mean it is not harmful, or it is malignant, that means it is purely cancerous in nature. So this is a step-by-step process of how a CAD system works in computer-aided diagnosis. So generally what we have seen that the CAD systems are basically being used as second readers, right? Because an analysis cannot be completed just by a machine. No doubt we are training these systems, but when it causes further treatment planning, when it causes the medication, when the impacts could be a patient's final health or condition, we cannot be just relying on a machine to give the output or suggest the treatment. So what we have seen in the earlier block diagrams, they are kind of very open systems. So definitely we should have a closed loop system to have a much bounded and a much stable kind of a outcome. So if we see that now this particular block diagram, we have tried to convert the open CAD system into a closed CAD system. Now how we have made it closed, if you see over here, this particular set is the blocks of the computer aided diagnosis system, which we have already seen. So now what is happening? These input images are given to a CAD system, and in parallel, they are being observed by a medical expert, or you can say a physician or a radiologist. Now, radiologist or the medical expert is taking inputs of these CAD system. It is using his or her own wisdom. Then the outcomes of the CADX, that is the diagnosis system, and then it is formulating the diagnosis. Why? Because in the outcomes of the computer aided diagnosis system, there is something which is very harmful, and that is known as false positives. Now, false positives are actually those fake findings which are being mistakenly done by the machine, where it prompts out that it is something is harmful or something is tumorous, but actually it is not. So this becomes very harmful at times, that something is not cancerous and it is being mispointed out by the system as cancerous. So it is actually the final role of the physician or the doctor or the radiologist to check, to validate those images, and then give the final diagnosis. So a radiologist's decision is mandatory to act upon these marks, and anyhow, these systems will be helping these radiologists or medical experts to improve their diagnosis. Now, coming to a new phase of these diagnosis system nowadays, that is intelligent CAD systems. So definitely today everything is being governed, ruled, or you can say we are coming up with a lot of systems which are smart systems, AI integrated systems. So definitely in a span of last 5 to 10 years, this CAD system is also now become intelligent, and they are being called AI based CAD systems. So when we talk about intelligent CAD systems, these intelligent or AI driven CAD systems are using deep learning. Now, what is deep learning? I mean, deep learning is a very big area, not much to be discussed over here, but just a quick review. The deep learning is an evolutionary version of ANN that artificially models neural network of the human brain with a computer. So generally, it uses a structure which is known as convolutional neural network. I mean, this is a modified or an improved version of your artificial neural network, that is convolutional neural network, which is the fundamental building block of these deep learning systems. So if we see, this is the a very general architecture of a deep learning system. So if we see the initial layer over here, which is shown as the convolution layer. So if we remember from a signal processing point of view, that whatever filters which are being performed on particular signals, they basically perform convolution over there, right? When they are being applied on, say, whether it is a one-dimensional signal or a two-dimensional signal. So actually, it is this convolution layer which is doing something which we have termed as pre-processing, right? Then we have, say, pooling layer, then we have another convolution layer. So again, this is another layer for filtering, right? Then these pooling layers over here, they are being used for, say, feature extraction, and finally, say, classification. So now what has happened is the basic blocks of our CAD are same. They are still pre-processing, feature extraction, and then classification. But now what has done? They have been packaged into a complete architecture, which is known as a deep learning architecture, or you can say this or refer this as a intelligent CAD system. So now, earlier we have known we have CAD E, we have CAD X, and now we have, with the empowerment of AI, something new term comes over here, which is known as CAP, that is computer aided prediction. So now when the AI is being integrated in these CAD systems, beyond diagnosis, they are also predicting a lot of more inputs, lot of more outcomes, which could be very helpful for the medical experts. So this you can again see how a computer aided system with deep learning is actually working on, say, this breast x-ray images. This is the input image. Now with the help of these convolution layers of the CNN system, it is being processed. So I mean, it is not visible so clearly in these images that the enhancement is done, but say enhancement, or you can say initial filtering, is being done over here, not enhancement in a very true context, right? And then you have different pooling layers over here or dense layers over here, which are actually performing feature extraction and say classification. And then at the outcome, what you are getting, say you are getting markings. So these markings on the malignant regions are being marked by the system guidance. And finally, it is also classifying your image into malignant, benign. I mean, whether this tumor is harmful, it is less harmful, or rather that this particular image is a very normal one. So now this is a complete package of CAD which is being done under a simple, or you can say a very single, not simple, but a complex architecture under deep learning. So this is more clear, or you can say more detailed framework that you can see over here, that again you have an input image. Then through deep learning we are achieving mask detection, that is enhancement. Then again through deep learning we are attaining segmentation. Then again with this we are attaining, say, feature extraction and classification. So basically all those steps which we have seen that say they are a part of, say this is your CAD E system, or say whatever CAD X system, it is actually now embedded under a capsule which is known as intelligent CAD, or you can say call it a deep learning based CAD or AI powered CAD system. And when you see the outcome of such kind of systems, then this kind of a image, I mean, this kind of a outcome you get from these particular systems. That means the analytics is also there. Then there are a lot of other findings. That means it is not just the segregation into being benign, or you can say malignant, but you can see that different grades are being mentioned, that what grade of that particular density of tissues is there, what type of tumor it is, or what is the category of that tumor. All these micro findings are also being predicted as the outcome of such a kind of a system. So if we take an overview of this basically AI powered CAD systems, then you can see the one term CAD E, which you are now aware. This is computer aided detection system, where the tumor region is enhanced and it is segmented. Then say this is a computer aided diagnosis system, where some quality score is being given to the image, segregating it into some category. Say here both CAD-E and CAD-X is being done over here, right? So these are the three things which we have already known. Now there are two more terms which actually comes over here, that is known as CAD-T and CAD-A. So CAD-T is basically computer aided diagnosis with tri-age. So tri-age is actually when a system marks some particular image that it is a very suspicious case for priority review, right? And CAD-A is some category which is an autonomous category, where automatically images could be interpreted without any clinical input. So it is, a kind that, suppose a particular hospital is having a lot of caseloads, right? And the expert radiologists are very less. So this system can sort, or you can say they can segregate these images, and maybe the high priority cases can be segregated and they could be viewed, visualized for expert opinion to the radiologist in comparison to the all other images when there are huge caseloads in the hospitals. So this is another way of viewing these systems. Say if I see these AI CAD systems, you can see this first framework in which a medical image is there. It has been visualized by a doctor and a CAD system. Then doctor is taking the outcomes from both CAD and a second doctor, and the result is being given, right? This is one way. Then again, there is another way where the image is going to a doctor, then it is being processed by a CAD system, then that analysis is used by the doctor to give the image. And another way is that the image is given to a CAD system, then with that analytics, the doctor is predicting the results. So in any case, you can see the middle system is actually the optimal one, because over here the analytics of the CAD system and the own subjective findings both are being taken into incorporation by a doctor to give the result. Then comes what is known as AI CAD datasets. Now, if we are talking about deep learning systems are basically, they require, since you call them deep learning, you have a lot of layers which are to be trained in this particular system. So definitely when there are a lot of layers, you require large amount of data for training and learning of such systems. So that is why we say that these techniques are data driven, and definitely the outcome or the performance is actually dependent on the power of the image data collection. So you have more the number of images for training, more good is the outcome. But if you see that for some particular disease or something, if you have less number of images, so less less cases are there, then if the system is less trained, then definitely you cannot rely much on the outcome of such a kind of a AI CAD system, right? But there is something which is more important, that it is not only the amount of data, but actually the quality of the data is also important. So that is why it is being purely advisable that as a electrical electronics engineer or signal processing engineer, or you can say as an image processing expert, what is required is that such pre-filtering techniques, or you can see these enhancement techniques, they should be actually embedded prior to this deep learning system. Because once you are embedding them prior to this deep learning system, then you can do a lot of filtering on that data. You can improve a lot on the quality of data. So once the quality of that particular data is improved, then doing analytics, doing feature extraction, or doing, say, classification after that refinement of data will certainly give much better results than maybe just processing that data directly. Then so just if we take an example that a CAD system is first built with, say, 1,000 cases, its system performance can be improved with 10,000 cases, and practically with usage, it may aim for 1 lakh cases or even more for a better workability. So there are one drawback you can say with these AI-centered techniques, that you need lots and lots of data for that training and prediction to come out, right? This is some of the examples of these public data sets which are being curated by different health agencies worldwide to support for training of such AI CAD systems. Now, another important aspect over here, I'll quickly touch up, that is data augmentation. Because sometimes when we are talking about normal images, then normal images or natural images could be too many. But you can see that the medical images cases are literally very less. So what actually data augmentation does is, the data augmentation is a technique that increases the amount of data just by pre-processing that input data, such as rotation, contrast enhancement, noise addition, or say addition of other artifacts in that particular data. So this is a kind of technique with which in a particular data set, say suppose if we're having one particular case of a particular say disease in or an image, then I can generate say 50 different combination of such images by making minor pre-processing modifications in those images so that the system can be trained in a better way. So this is how, with the help of data augmentation, these data sets could be made more voluminous if we have less number of cases. Another one, I mean, generative AI is a very burning topic these days, and the heart of such a system is the generative adversarial network, or what is known as GAN. So basically, GAN systems are used to produce newly generated image data. So today we all have seen that how beautifully AI is generating new or refined version of images. We give your image, we get a very, I mean, young, very defined or very pictured version of our image, which we actually don't look like. So here GAN systems are also used in medical imaging, where say suppose if we have a limited data set, then by training a GAN system, what we can do is, as an outcome, we can generate a similar kind of data just to increase the volume of that particular data set. So it has studies have shown that the data which have been generated through the GAN systems are approximately giving 20% increment in the system accuracy. Then if we coming to the closing or the last module, that is the CAD based research perspective. So if we see then this CAD system, then there are different phases, or you can say different modules where unique works or researches could be performed. So as a signal processing engineer, as a electronics or electrical engineer, then calibration of these medical devices, the registration of these images, then say enhancement and filtering of these images, designing sophisticated filters for noise, for enhancement, for sharpening of these images is a very focused area of research when we are talking about medical images. Then say improving the visualization and display is one area over here. Then feature extraction, segmentation, classification, that is all AI or deep learning based work could be done in this particular analytics, right? Then compression, archiving, retrieval, and communication of these images, right, over say a very limited bandwidth channel. This is another very niche domain in this. So if we explore CAD systems, then we have different case studies which are being available across the net. So this could be dealing with the breast imaging for prediction of breast cancer. Chest imaging could be there for prediction of tuberculosis, prediction of say maybe lungs cancer, then prediction of COVID-19. Then dermatology, these are the skin images for melanoma cancer. Then microscopy images, they are for counting say microscopic bacterias in particular say pathological slides. Then you have fundus imaging case studies are available, where you have retinal images for prediction of anomalies or diseases pertaining to human eye. Then with brain imaging, you have multiple anomalies, multiple life-threatening diseases like brain tumor, brain cancer could be predicted. Then abdominal imaging could be done with ultrasound. So fetal growth, fetal stages, all this could be predicted with the help of this ultrasound image analytics. And then a very big area over here comes is fusion, because nowadays if we are not getting good amount of input from one particular modality of imaging, we take the response from a second modality also, and we try to fuse these responses to get a much better and accurate diagnosis. So again, medical image fusion is now also a very developed area of research. So certain challenges which are posed by these AI CAD systems. So as we know that data issues in terms of content and quality is a problem, because in medical images, it is very difficult to curate data. Then most of the applications, they are good for say one medical imaging. They may not be good for another medical imaging. Then image labeling and annotation in terms of large data sets is also a big problem. Then black box issues of deep learning, because nowadays, since these deep learning architectures are ready to use, people are rarely concerned about it, that what is happening inside those architecture. So the research in this domain some way has been very simple, that people just feel that we drop the images in the deep learning network and you get the processed images from there, without even understanding that what is the architecture or how useful that architecture is for computer aided diagnosis, right? Another thing is image reconstruction, image quality improvement, or you can say image processing for filtering for dose estimation. All these modules are till now they are not very well catered in the deep learning system. So definitely, if we have a precursor system or filter design which can just take up image improvement in these terms, and then those refined images are given for further analytics for these deep learning system, then responses can be much better, or you can say the diagnosis can be much more reliable. So I just would like to conclude with a very statement from one of person, that is Curtis Langtos, in 2017. They say that radiologists who use AI will replace radiologists who do not. So certainly, the people who are old, people who are maybe very experienced, or those who are not very tech savvy in terms of computers, so those doctors are not supporting AI or computer aided diagnosis. They say that it is totally a misnomer, or they say that it is totally confusing the doctors. But so rather, a more important or more concluding way for this is that the transition to AI support in diagnostic radiology should proceed like the adoption of self-driving cars, because slowly, carefully bringing trust and improving systems along the way with a focus on safety too. It is just the same at, our reliability on self-driving cars couldn't come so fast. It could not come so fast. So definitely the medical reliability on AI support systems will also take some time. So generally the content resource which I have referred in this particular talk, I have taken from one of my book, which is focusing on computer aided system for early detection of breast cancer. And this is one sample of my upcoming book with my scholars. This is computer aided diagnosis of glaucoma using morphological filters and machine learning. And so now the forum is open for questions.
Sir, thank you very much. It's a fantastic and marvelous lecture, sir, because you have given a complete idea. It's like people who are doing some research in this field, it's like a starting point, and they have a clear picture of what they are supposed to do. Sir,
Thank you,
can we
sir.
take
Thank
up
you.
one or two questions, sir? Because I think there are, there is a short of time we are running actually.
Definitely, we can take up.
One or two questions, sir. So here is one question, sir. From so the thing is like
Yeah.
I told you that there are many. Usually there are the participants are majorly students, but interestingly, 90% of the participants are faculty members, professionals, and research
Okay.
scholars this time.
Okay. Okay.
So the first question is, are there any pre-trained deep learning model structures available for medical image diagnosis and classification, similar to how YOLO structure is used for general object detection? This is from Dr. Ganesh.
Yes, I mean the image, one framework, if you've seen in my last slides that I have shown. So over there, you can see that the YOLO structure over there is being used for mask segmentation initially, and then some other deep learning framework is being used for feature extraction, and then say a different deep learning structure is being used for classification. So there are a lot of such pre-trained nets or networks which are being developed, but as a part of research perspective, what I advise is generally over here, or what I suggest this for, more novel or more improved research in this particular domain by my experiences, because my work is more focused towards, filter designing for these enhancement and say denoising filters. So I have seen that whatever architectures are there in these particular deep learning system, they are well trained for feature extraction. But if you talk about pre-processing, then they are doing very fundamental level pre-processing. So this is not very, very beneficial when you are using the medical images. So for medical images, we need to have some precursor system which is dedicated, meant for, pre-filtering or say improving these particular images before they can be given input to a particular deep learning kind of a system.
Yeah, thank you, sir.
Sir, I had one more question.
Yeah,
Myself,
Dinesh.
Dr. Ganesh from GVP College of Engineering. So
Yes,
that is my
please.
question only because of some noise in my house, so I posted there.
Uh-huh.
So my actual question is, this YOLO object structure, what we are discussing, no, sir? So it has been evolved from version 3, version 4, version 5. There are
Yes,
some
yes, yes,
upgradations, right, no, sir?
yes.
In the similar kind, like, is there any pre-trained network available so that that can be used as a base, and we can upgrade the structure, and we can evaluate on the diagnosis and classification? That is my exact question.
Okay.
Are there any,
So
like COVIDX, some kind of classification pre-trained network is there, no, sir?
yes.
Like for CT scan and all, is there any pre-trained network is available? That is what
Yes,
my
there are. I mean, see, for a particular modality, you have, very separate data sets which are being available, and you have pre-trained networks which are available. But what I'm suggesting is that they could be, beneficial just for very, very initial use, but they may not give you, outputs for very trivial cases if you are being performing it as a particular case study. That's what I'm suggesting. I mean, just for a very, very initial usage, say at a very UG level of a particular work, it is very good enough that, you are just putting an image and you are getting a trained output over there.
So one more doubt with me, sir.
Yes.
Like when we use like deep learning network for classification or for classification task, so is that hyper tuning parameters has dependency on the type of data set we have considered, or once we decide the hyperparameter tuning, is that
Yeah.
can work on any kind of data set? Say, for example, I had a CT scan data set with me, like having
Yes.
10,000 images as the data set. So I have tuned maybe 10,000 training data set I had. I have tuned my system with hyperparameters, and I have got an accuracy of 99, let us say, sir. Now, if I want to use some other CT scan data set which was collected somewhere with some other industry standard, let us say some other make.
Yes.
That is what my question. Now, will by network, means the model what I have proposed, will be giving the same accuracy with the same hypertuning parameters, or do I need to retune those parameters?
No, you have to retune the parameters depending upon the changing data sets. You have to retune it slightly. And that is what actually you will get, that how system performance is being diverging with the change of data sets.
Okay, sir. That is my another question. I am not into medical image, sir. Actually, one of our students were doing, and for him on his behalf, I am asking. One of my scholars is doing that.
No. See, that's what I'm advising, that if you are applying, I mean, you have a lot of works available. on say medical imaging, which are using CAD and AI systems over there. You are using deep learning. But whenever you delve deep into it, you will always get to understand that these 99% accuracies are just very, very superficial kind of things. When we go to actual validation of such results with some particular doctor, if you have involved with yourself in a particular case study, then you actually get to understand that the things are literally turntable over there.
Yes, sir, sure.
Yeah.
Thank you, sir. Thank you for clarifying my doubts.
My pleasure.
It's a wonderful
My
presentation, sir. The animation and all, it's so interesting. Thank you, sir.
Right. I mean, this was a very short duration one, so I have to move little faster. I mean, next time, whenever I'll get opportunity for a different lecture, maybe, or say a long session, then definitely we can take a very specific case study in detail.
Yes, sir. Yes, sir. So actually, there are a few more questions, sir. But anyway, I'll forward this email ID to those people because they all are research scholars and they have started some of them pursuing PhD in at JNTU Kakinada and some other universities. Certainly, if we start, I don't think the time will be sufficient. But having your email ID with them may be much more advantage. So I just forward your email ID and ask them to get connected directly. Maybe.
Sure.
If you don't mind,
you can, if there are any quick question, they can take up in another 2 minutes, or you can forward them.
Yes, sir. One, it's like a binary question. One question. Is the feature reduction or the dimensionality reduction technique like PCA and ICA, I mean the principal component analysis and independent component analysis, are advisable to medical image processing?
Yes, they could be advisable to some extent, but again, it depends upon that what kind of diagnosis you are doing. I mean, if the diagnosis is very straightforward, that you are just segregating it into say benign and malignant images, they could be good. But say if I have got the malignant images and I want to further segregate it into 5 different grades of malignancy, then at that particular phases or at that particular state of juncture, this becomes literally difficult.
So I'll ask her to write a brief email regarding her problem to you. Maybe she can discuss with you in future. For now, sir, because there is a set of questions that she is putting. It is like a connected thing. So I will ask her to get connected directly. Maybe maybe in the interest of time.
Yeah.
So now let me just take the opportunity to quickly move to vote of thanks, and now I request Dr. Pulikishore Kumar, NIT AP, to do the proceedings of vote of thanks. And I forgot, sir, actually we also have from the section, the treasurer, Dr. Chisti, Moinuddin Chisti, who has joined with us.
Yeah, good evening, sir. It's nice lecture, sir. Actually, you covered from starting to
Thank you, sir.
many years. It is a quick start for a researcher to begin with the medical image.
Yes.
Yeah, you have done all the literature review part for them, sir. Nice.
Yeah. Thank you, sir. Thank
you, sir.
Sir. Now over to you, sir. Pulikishore Kumar, sir.
Yes, a very good evening, sir. Thank you so much for giving me this opportunity to convey the vote of thanks. Especially my special thanks for the expert speaker Vikrant Pateja garu for delivering this outstanding lecture, sir. Really, it's a very impressive and magnificent lecture. I just want to add one query, if you permit me, sir, because I also work in imaging. Actually, I work in radar imaging, sir. When it comes to radar imaging, we usually will send the RF signals. It's a time domain signals. So whether it is radar imaging or medical imaging, we will extract the image from the received time. So usually I work specifically in that area, how to extract, what are the best way methodologies for extracting the time domain, for extracting the images from the time domain data. Nowhere in medical imaging which methodology is used to extract the images which you usually people consider as a raw database images. So whether it is CT scan or X-ray imaging, what methodology?
I just correlate one thing over here, that how you can go about when we are talking about, say, radar imaging generally, then radar imaging is actually, I mean, these images or radar images, or say whatever are the remote sensing images, satellite images, these all images are being affected by artifact which is known as speckle noise, right? And this speckle noise is actually being a multiplicative noise model which is being used. So if you correlate this with the medical imaging, then ultrasound imaging also suffers with a similar kind of a noise which is known as speckle noise. So again, the noise model for remote sensing images and the ultrasound images is almost the same. So what I advise you, that for a feature extractive part, if you see that whatever feature extraction techniques which are being deployed in case of, say, ultrasound images, they will somehow be very functional or effective when you are taking up these radar images, or you can say these remote sensing images.
So, my query is actually which methodology is used for extracting the images, whether that approach methodology of extracting the image is good enough or any development is required. That orientation, why there is no much development as such?
See, that's what I'm saying, that the feature extraction methodologies are generally very common when you are practicing with these images. Only the point is that feature extraction could be prominent only when the high noise which is being present in these images, this is being, eliminated or removed. Once this noise, because these are radar images or remote sensing images, that yeah, so this noise factor is very prominent over there. So once this noise is eliminated to a good extent, then generally common feature extraction techniques, I mean, depending upon the nature of image, what is being done there, or what type of, analytics that you want to make, I mean, those common techniques could be made applicable.
Okay. Thank you, sir. Thank you so much, sir.
Yeah.
Thank you so much for sparing your valuable time to enlighten all of our Vizag Bay Society's participants to get a good knowledge and a good understanding of the current methodologies related to the computer-aided diagnosis of life-threatening diseases. So I hope many of our participants have gained a good knowledge. You have started from the basics, actually from the basic segmentation and then filtering, pre-processing, and the way how the lecture went. It's really a very good lecture. We're very thankful to you for considering and accepting our lecture.
My pleasure.
We are very fortunate to have you, sir, actually. And I would like to thank you once again on behalf of the Vizag Based Society, Signal Processing Society, and even the ComSec joint societies once again for accepting our invitation. Hopefully, in future also we may join something, maybe if possible online or offline, based on the activities that are supposed to be planned under this society in future also. So we request you to consider this society in your future talks also.
Okay. Yeah, sure. Thank you so much. Yeah.
Once again, I would like to thank our team of IEEE Vizag Bay section, ComSoc and SPS joint societies. Vizag Bay Chair and Director NSTL, Dr. Abraham Varghese garu, for sparing his valuable role, particularly in moderating or formulating the things specifically for Vizag Bay section. The past chair of IEEE Vizag Bay and the professor in Andhra University, Dr. Lakshmi Narayana garu, for advising and making the Vizag Bay, the formulating and reframing it to this particular section from subsection. We would like to convey a special thanks to him as well. the Vizag Bay treasurer, Dr. Kishti Garu, the professor in Geetham University. We would like to convey our thanks to you as well, sir, for coordinating and making this event, participating in this event as well. A special thanks is very much required for the chair of this Vizag Bay Signal Processing and Joint Signal Processing and Communications, Samir Garu. Actually, your initiation and your involvement in organizing the activities and events is really awesome and extraordinary, sir. We were very much fortunate to have you as a vice chair for this IEEE Vizag Bay section, sir. Really thankful. We were very much thankful to you and all the participants and the members who joined over here. Without you, it is not possible for the event to be a very grand success. Actually, the knowledge sharing is one of the main objectives of this IEEE. So knowledge sharing, this is a very good platform where good experts, something like our Vikrant sir and many other experts who can share their knowledge. And important thing is without gaining in the sense, without expecting anything from the in response, without expecting anything from in response, delivering the knowledge or sharing the knowledge voluntarily is really one of the greatest initiative of this IEEE, and we all are thankful to IEEE as well. So once again, thank you so much for one and all who directly and indirectly contributed and cooperated in making this event a grand success. Once again, thank you so much, sir.
Thank you, sir. Thank you very much.
Sir.
So,
Thank you,
so one last thing, sir. Vikrant, sir. I just need your consent to keep this recorded video on public domain like our YouTube channel.
Yes,
Is it
absolutely.
okay for you?
No problem. No problem. No problem. Please do.
Thank you very much. Thank you.
Yeah.
Thank you, sir. Thank you.
Okay. Thank you, sir.
Thank you, everyone.
Good night, everyone.
We'll be closing. Good night. Good night, everyone.
Good night.
Thank you, sir. Thank you, sir.
Thanks, sir. Thank you.
And Chisti, sir. Good
Thank
night,
you.
everyone. We are closing the meeting now. Good night. Good night, each and everyone.
Stop video recording, sir, and then close.